in all my AI lectures is I actually poll the audience, let's just start with what we've all heard about, ChatGPT. Who has used it? And you would be surprised how many people have not used it.
Mm.
One of the first things for anyone who has not gotten on this is actually go look at what it's capable of. And I think a lot of what is concerning to individuals is this fear of the unknown. Either they think it might be just kind of a fad, it's not here. This AI is going to be as transformative, if not more, than when the internet.
Hi everyone, Eugene Shatsman here, and I am excited to host the Power Hour for you. I'm also really excited about today's show because it's on one of my favorite topics, AI. Look, one of the hottest topics of conversation, all realms of business, and probably society in general today, is artificial intelligence. And optometry has certainly been no exception. Some of us have avoided it, some of us have cautiously tried it, and some people have jumped in with both feet. So today I interview one of those people who has jumped in with both feet. She is one of the leading speakers in the vision industry on AI. Dr. Roya Attar is a professor at the University of Mississippi Medical Center. She sees patients, she does research, she's taught optometry students, she teaches ophthalmology residents, she has an MBA, she's recently finished her second doctorate degree, and I could keep going. She's very impressive. And today we engage in a conversation about how AI is changing our optometric landscape, and we discuss some adoption options. We talk about clinical opportunities like imaging intelligence, growing referrals, scribing, AI and patient education. And we also venture into conversations around business processes, business tools, having better meetings, communicating with patients, creating value. The list goes on. Dr. Attar believes that AI is here to stay. I absolutely share that belief with her. So throughout the conversation, I try to chime in with some of the things that I've been talking about from my speaking circuits recently, things that I see working in the field. And I think we both agree on one thing. You just have to give it a try. And we talk about that on the show. So before we get into the show, I want to remind you to subscribe on YouTube, Spotify, Apple, wherever you get your podcasts. And one more thing, I've been absolutely thrilled to hear audience feedback from you. If you're listening today to the show, please share your thoughts with me. You can reach me at eugeneshatsman.com. That's just my name.com, or the Power Hour Optometry website. I love hearing from our listeners, answering your questions, and I'm excited to be a resource for you. Okay, and with that, let's get to today's conversation. Dr. Roya Attar, welcome to the Power Hour. I'm so excited to have you here. It's an honor and a pleasure to have you on the show.
Thank you. I'm delighted to be here.
Well, and so the backstory for our listeners is that we are both on a panel later this year, and the panel is around all of the concepts around AI. And AI is such a big nebulous topic, and multiple people have different perspectives. And I'm sure you and I have some variability in our perspectives, right? You're a professor, you see patients, you teach students, you have all kinds of things that you're involved with on a regular basis. And I do growth consulting, marketing, those kinds of things. And so I get a different perspective. And I think that's one of the reasons why we were asked to be on a panel together. But you lead the panel. You've also been one of the most, I think, predominant speakers on AI in the optometric community. And so I wanted to bring you on the show and just have a conversation about what is, the topic of AI and what should we be paying attention to today, and really just get some of your perspectives on it. So let's get to the beginning. How did you even get involved in AI and become the resident expert for the optometric community?
Oh, well, thank you. I don't know if I'm necessarily the resident expert, but I feel that I sort of landed in this spot because I was a very early adopter of it. I started hearing about it and I started researching into it, kind of did a deep dive, and I thought, this is interesting. This is really going to make a difference in the healthcare world, and especially in the eye care space, because eye care in particular, as we've all known as physicians, the eye is special because through the eye, we can see so much, and it's a image-heavy profession. So those images that can teach AI, I mean, it was poised to really make an impact in our profession. So I wanted to know because, as I always said, I wanted to be on the forefront of it, and knowing that a lot of people just thought maybe it might just be a blip, or it's kind of going to go away kind of thing. And then when I really got into it, I thought, AI, it's not something new. We're talking a lot about it now. You hear about it, but it has been around for a long, long time. And so one of the things I actually say in my lectures is, you've all been using AI since the first time, you punched a calculator. That's AI, actually. That's a machine doing a knowledge task. And there's different forms of AI. So if you really want to get into the nitty-gritty of it. And but yeah, that's how I ended up into it. And I tried, and I have stayed abreast of everything that comes out. Recently, just a new retinal imaging camera just got approved for the FDA yesterday. So that was exciting news to hear about that. And so yeah, that's how I landed in this space. And I was asked to do this panel, which will be in February of next year, actually. And I got to have the honor to meet you. And that's what's been really nice about this space, is because so much, it's not just in our space. AI is everywhere in every capacity. And we know in our profession, there's so many different facets. And with you, with that business aspect that's so valuable to the profession and to healthcare in general, and your insights, and speaking to you, that was very enlightening for me too. So I'm looking forward to our panel and to our discussion today.
Yeah, and it's really fun as you're talking about it. It's true, I think, that we've been using computers for knowledge tasks for a long time. But what's new, if you really think about what's new, is that last year, ChatGPT kind of took the world by surprise, and we all got introduced to these large language learning modules, right? Like the fact that the computer can train itself and then can communicate with you in human-like fashion, and you can start asking things more like you would a colleague than trying to format it in a way that makes sense for a machine. And so I think that's what became the fascination for the AI world. But I agree with you. I mean, machines have been doing knowledge tasks for a long time. So what are some of the kind of nuances of where you started? Because we're going to get into some of the things that you teach, right? But what are some of the nuances of where you started, and what was like the first big AI thing that you did that you're like, oh, that's a cool innovation. I'm gonna, that's interesting.
Well, I have to say, ChatGPT, just the free version got released, but they've been working on it for a long, long time.
Yeah.
We were one of the biggest AI things that, like I mentioned earlier, that we can do in our profession is, looking at images. So I've actually I got intrigued with AI when a new retina image camera was approved to the FDA back in 2018, I believe, TopCon. And this was through a company. They did their testing in Iowa. And but this was not a camera, and this was for diabetes, which I am located in Mississippi, and we call it the diabetes belt, and Mississippi is the buckle of that belt.
Oh.
So any diabetes news is really big. So right about that time, I saw this camera came out, and it was not something that was targeted for our clinic. It was actually targeted for the clinics of PCPs and endocrinologists to do a fundus image and without dilation, and it could spit out an immediate answer, either no retinopathy, check again in a year, mild retinopathy or more needs to be seen. And this was extremely valuable because a lot of these patients in these rural areas, so many counties don't even have an eye care provider. So to be able to have this imaging device that says, hey, how important is it for them to see a physician right away? That was super valuable.
So what's interesting about that point, I just want to point out for our listeners, is that a lot of people talk about how AI is going to take away jobs and create opportunities elsewhere. And that may be true for a small subsection of things that need to be repurposed, right? But I do think that what you're describing, right, here is a tool that you put in the hands of non-optometrists, not to diagnose a disease, but as a screener to get more volume to the local optometrists and ophthalmologists, right? Because without that tool, that patient might have never been seen by an OD.
Correct. And, and that same tool that's super valuable, that I also saw the sort of the shortfalls of it or the shortcomings of it. And so one of the AI, we have to realize it's only as good as what we teach it,
Mm-hmm.
ask for it to look for. So that same image, it could tell a patient you don't have diabetes in your eyes, but it did not tell them if they have glaucoma.
Mm-hmm.
And a lot of patients, and so those patients may have thought, okay, well, maybe I don't need to go to an eye because I don't have diabetes. So that was where it was very important for me to be knowledgeable about it and make sure that, hey, this is out there. Yes, it's a great screening for this particular disease, but it's not necessarily looking for other things. So it's only as good as what it's designed for, what it's teaching. So one of the things that we would also get is a lot of those images from those cameras to make sure to verify it was correct.
Mm-hmm.
It's interesting. And like I said, it would pick up things that I would have easily have missed, like a heme here or other
Mm-hmm.
clinical things. Sometimes as clinicians, we get so we have this preferential looking is what I called it. So if someone's coming and I'm looking at this one thing, I forget to look at the other thing. But AI was better about finding all the little things in the eye. And so that, because I always say kind of as an aside, and well, actually, this is important for clinically and for, one thing that I think physicians often do is you've probably heard this in your world, we underbill, I think in our profession quite.
Mm-hmm.
On the clinicianer side, we also underdiagnose. I've seen patients which are coded as mild retinopathy, which they should certainly have more moderate edging on severe. That matters because you're going to follow that patient a little bit more closely and a little bit more
Sure.
often. So it happens quite a bit. And I think AI is a really, really great tool that we can have in our toolkit to help assist in that.
So with AI-based imaging, how are you seeing that being used in practices today? Because the story you told was from 2018, and I know that technology is still around and has evolved. So what are you seeing in clinic today, and how is it helping providers?
Well, in our clinic, let me tell you what we have done for years as providers before AI. I would get a really great image from a colleague, or I would have one and I would send it to a friend, text it, hey, what do you think this is? Not knowing anything else. And so we've been doing this for a while. We'll diagnose something from an image, right?
It wasn't artificial intelligence, it was collective intelligence.
There you go. There you go. Now, instead of me sending it to a colleague or a colleague sending it to me, waiting in between patients, I got to get a look at it. Now there's actually modules, and actually the name of the one leaves me right now, but there's actually approved systems where you can go and upload your OCT and upload that, and it'll spit out a diagnosis for you. And so that's very, very helpful when, frankly, you may not be a physician that likes to look at disease state a lot, or, and that's okay. Not everybody likes to do that. And so this is a great assistant tool to know what it is, which then matters how often we follow that patient. If that patient needs to be referred, how quickly they should be referred. So that's quite helpful.
Yeah. And so in clinic, you're actively using this right now.
I'm personally not using this. In our clinic system, I could say that, I don't know, fortunate or not, but I know it's out there. I want to know who is using it that's sending me the patients.
Okay.
Yeah. So that's how I've become familiar with it. And it's actually quite been impressive. So because I work in I'm the one and only optometrist in the Department of Ophthalmology here. So a lot of the patients, I'm the initial person, I'm sort of the clearinghouse that get referred or that get sent in by other specialties. I'll decide if they need to go to retina, to cornea, to glaucoma kind of things, or if I can hold on to them and watch them. And so a lot of these usually I've been used to getting a picture saying, hey, do you want this? And now I think that, and my colleagues around the country, I think people are becoming a little bit more savvy using AI to kind of like read their OCTs. I've seen better OCT interpretations, but it's really nice. I think if anything, it's certainly enhanced everyone's diagnostic ability. And I don't see that it's taken anything away from the volume of, patients that are being seen. What AI misses, and I think you can speak to this too, is, that human touch.
Yep.
But certain things it also doesn't have, which are good, is like a bias, a preferential things that we intend to do. But sometimes that's actually needed in a clinical setting.
Yep.
Certain patients need a different type of care, not necessarily bias, but that human touch. And so do I think that it's coming for us, or, when they say it's one of the professions that we might be replaced? They've been saying this about radiology since I can remember.
Yeah.
They are still around. If anything, they're expanding. Their field is expanding. They're doing way more things. And that's exactly what I think is going to be in the future for us, that we are going to expand. We're going to be able to see things, diagnose things better. And most importantly, what everybody wants, so we're going to be much more efficient, which is super valuable.
Yeah, and that's actually where I wanted to go next is efficiency tools in a practice. AI, I think, has done wonders for helping people communicate more efficiently in certain cases, and we've seen some of that in some of our work. But and my question to you is, in clinic, or for a typical optometry practice, where do you see efficiency as one of the benefits of AI?
Oh, well, one of the ways I use it right now, and I think you asked me this earlier, it's not directly related to our program. In most hospital settings, we use an EMR called Epic, and I think it's going to be upgraded eventually. But I literally utilize AI to help me write my clinic notes, and it writes great clinic notes. It also has helped me write great patient education to send out and take home. One of the things, I could see patients all day. One of the things that kind of slows me down is the writing part of it. And I think we would all love to have a great scribe. We really would love to have a scribe. And now there's programs, AI programs, that can be a scribe for you. And that, I think, will be one of the most valuable things. That if I had to guess what thing will most practices acquire the quickest, it would probably be a scribe for the clinic portion, and some, the tools, diagnostic tools. Those two things I could see being adopted really quickly.
That's really interesting. So again, describe for me the workflow, and for our listeners, the workflow of how AI works with you as a, I guess, a scribe and a note taker and a patient educator.
Well, fortunately, a lot of our templates are pre-built. But for example, when I diagnose a patient, kind of help. Actually, let me kind of give you, I'm going to go off the beaten path that we're on right now. Because of my unique position, I sometimes don't know what I get. I get a smorgasbord of things. And there's one area I can say is not my strength, which is an area of binocular vision. And there's a whole plethora of tests that we learned that I may be using a blue moon. And every time I had to use it, I had to go back to my books or pull out some notes and say, how did I do this? Now, and to be honest, and I'll be very frank here, I just went on to ChatGPT and I said, well, listen, I have a patient. This is what the patient has, and I need to do this particular test. Or would you recommend, or what other test should I do? It easily told me I need to measure like the negative or near point of accommodation, and it's all these other tests that I did. And I said, how do you do that? It wrote it out for me step by step. And it talks to you like so it kind of did that for me. And then as far as writing the note, I'll write the note. I'll say, okay, I have a patient diagnosed, for example, with that particular patient. accommodative insufficiency. I don't remember exactly what that patient had. But I hadn't written a note for that for a while. And I'm like, write out a clinic note for me. And it just wrote it. And I took the pertinent parts and I put it into my note. One thing, if anyone's used any of these AIs, and tell me if this has been your experience, they're kind of chatty. It's almost
A little verbose, yes.
yes. So but then you just sort of teach it like, okay, tell me in less than like in 2 sentences only, condense it. And that's what's so nice about it. The more you teach it, the better. And I liked it because it's better than an assistant, and you just tell it what to do very frankly, and it likes that. There's no please and thank yous in there.
Oh, you know what? I don't know what it is about my upbringing, but I still say please when I enter my Chat GPT prompts.
I wonder if it appreciates it,
Yeah, it probably is like, this guy's a goofball. He doesn't need to waste his time.
Yeah. Yeah, it's really interesting. I'll find myself writing it like I'm talking to my actual assistant with a please or thank you or great job, but
well, and so are you actually having it record your clinic time potentially? Have you tried that at all?
we don't have that capability yet, but
I haven't seen a tool that allows you to do that.
But as we just had our faculty meeting, we're talking about patient wait times and efficiencies and things like that. I would very much see this being adopted as a way to essentially make us more efficient, that can record all those things, catch little things that don't make sense. I do have a great scribe, but every once in a while, myself or her will make a mistake. And, I love it when our little tool pops up and says, hey, this is, are you sure you want to write that?
Yeah.
Or now, and you can appreciate this when you're finishing out a chart, it says, hey, you're undercoding based on what you've done. Should consider adding these. There's new codes that come out that maybe I'm not familiar with right away. I think a new code has come out that's been really helping for these patients that we follow very closely. You can add on, and it helps with of course, increase our, in my case, RVUs and of course, revenue for the clinic. Says, hey, don't forget to add this code. It applies based on your chart. And so that's so nice.
Yeah.
Someone having my back.
Yeah, that's interesting. And I think about AI recording things and listening for meaning, but it could even be simpler than that, right? We have, and I would ask the audience to think about how many people have meetings with their staff or are part of regular staff meetings. Whether you work for a practice, whether you own a practice, you're probably in a meeting on a regular basis all the time. And then, maybe that meeting happens once a week, maybe it happens once every 2 weeks, but it almost always happens that there's at least one person on the team where when you reconvene, that person has amnesia about what happened in the previous meeting and what they committed to. And when you're asking, oh, what did this get done? Oh, I didn't know that was me. So, the simplest solution that's available out there that's so straightforward is just invite an AI meeting note taker to all of your staff meetings. Just take a computer or cell phone or something and just add it to your staff meetings. And then you've got a transcription, you've got a summary, and you've got an accountability step. And then if somebody misses the meeting, which also happens, right? Because then it's somebody's job, somebody couldn't make it or somebody was with a patient and whatever, somebody misses a meeting, then it's somebody's job to go fill them in. Well, forget that. Now they can look at the transcription, they can listen to the parts that are relevant. And when you realize that AI is listening, that somehow makes you a slightly more effective communicator. At least that's what I found. And sometimes I'll end meetings by saying, okay, well, so the action items are blah, 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 because I know the AI is listening for the words the action items are, so it'll really summarize them super well at the end. And just say, well, John's doing this and Susie is doing that. And everybody agree? Okay, great. Then all of a sudden, the AI just spits out a quick email summary that says, this is what John's doing, this is what Susie is doing. And it's really easy if I'm John and I missed that meeting for me to just type John into the notes and to see where did I come up in the transcript? When did I come up in the follow-up? And to me, that's such a straightforward, simple tool that everybody should be using. It's really kind of transformed our meetings in our organization, and it's really made people a lot more accountable too. And you also eliminate the waste of people going back and forth to each other to say, hey, what did I say I was going to do that, or did you say you were going to do that? And people are just like, oh, I know where to check the meeting notes. I know where to listen to them to the meeting. And somehow people also listen up a little bit more during the meetings because they know that this is there's already an accountability partner on the call.
Yeah, I love how you said that it makes you a more effective communicator. You're very correct about that. We're using the platform of Zoom. I used WebEx whenever I was, that's what we use in and obviously we do a lot more digital meetings and things like that. And so it has that capability too to transcribe the meeting. And one of my colleagues, if transcribes them verbatim, but you could see how many times this individual said, it was one too many. And that actually was kind of like, oh, wow, I sure do say it. I'm going to learn to be more effective. But I love that point that you put in there, that it does make us, again, more effective and more efficient too. So
yeah, Microsoft has a feature that will actually be a speech coach for you and will help you eliminate your ums, but it'll also tell you how much of the conversation you're dominating. And it'll actually give you a little warning and say, you spoke for more than 70% of that meeting. Just letting you know, you might not be getting the most out of that meeting if you're just showing up to hear yourself speak.
wow, that is really great. Yeah.
But that's more of a business tool. And let's zoom back into clinical and optometry and how do we help practices do better and be better. So obviously your perspective is that it's an efficiency tool, that it's a support tool for a practice. Where else have you seen it be helpful?
Well, for myself on a day-to-day basis, a few of the emails you may have even gotten from me were actually written by AI.
What program do you use?
I honestly, I've tried a few different ones and I still find ChatGPT does the best job. I've tried, Google Bard. It's good. I've tried Microsoft's new AI. All the different free versions. I will say before I commit, I always try to use the free version. But GPT, there's a reason most people talk. I feel that talk about this one in particular. I feel like it's the most powerful. Now, granted, there's probably more tools out there, and I try to stay on top of them and try them out. But I feel like that's the most powerful. But I'll tell it how to answer, and I've taught it. This is how I speak, and it'll know how to answer that prompt. And so it's very liberating.
Yeah.
We
were testing some tools, and last year we kind of had a mandate for our organization that anybody who wanted to, they could spend up to 20% of their time playing around with AI as long as they could communicate the value of that AI tool and how that AI tool potentially helps us serve our clients better or helps our clients be better off. So we really went kind of large scale testing and said, don't worry about paying for it. Well, that's part of our research and development plan, right? So we found a lot of interesting tools. One tool in particular will actually ask you a bunch of preferences and then will just respond to emails for you. It's a little bit too, it's a little bit too invasive for my taste, but the example they give on their, like during their demo, the actual example they give is somebody asking you what you want to eat for lunch, and this tool basically responding for you and telling them exactly what you're going to eat and why and what you would prefer to do that evening. And it can respond to your emails, it can respond to your texts. And I was like, okay, that's a little too much. There's got to be a line that's drawn, between why that person might be asking me that, and between what I'd call the transactional, which is I think a great place for AI, is transactional, repeatable, and again, the kind of the LLM, the language learning model, right? And so if you can teach it to replicate a behavior so that you don't have to do that behavior again, for me, that's somewhat transactional. And then there's the human side, which allows more time for connectivity.
Oh yeah, yeah. And what you said, I think that we kind of suffer from a lot of times too as humans is choice fatigue. We kind of so I with I'll have AI like decide, I said I'm going to have like a little event at my house, give me a theme for it. And because you can only think of so many things, and it just sort of kind of gave me all these other ideas. Or what should I eat tonight? That how you make poor decisions as the day goes on. It plants the seed and kind of does a lot of those thoughts where I can really save my energy and good thought for other things that I need to dedicate it to.
Right. It's a great brainstorming partner. And I think that, in my opinion, any time that you're starting a project, and sometimes people procrastinate and they don't want to start things because they don't know where to start. I think that it's the people that are using AI regularly, they're no longer procrastinating as much, or they know that I can always start by saying, I'm supposed to do this. Where do I start? And then, the AI will spit something out at you. And even if it's 10% right, then you at least have, a conversational brainstorming partner to help you get a project off the ground. And I think that, at least in my experience, and what my staff are reporting is that it's helping with reduction of that procrastination around uncertainty in large projects or in complex projects.
Correct. I've had a few colleagues, one of the things that has been big in the industry is promotion marketing. And they say if you're going to have there's a web page or a social media page, worse than not having one is one that's inactive. But then they're like, what should I post? What are these things? I mean, you just give it an idea. Hey, this is what should I post? It gives you just such great ideas. It puts in the emojis for you so that nobody can say inactive. So I really like for the marketing aspect, I really, really appreciate that too.
Yeah, well, and from a marketing standpoint, what I've found to be most interesting as a trending topic in my world is the fact that it can help convert. Because what's the role of marketing? The role of marketing really is to turn more of your prospects into patients, or to build awareness, and then turn some of the people who are aware of your practice into patients, right? So in my world, what I've seen, and these are tests that we've been actively running, is that you can use AI as a conversion conversation tool. And so we've tested bots where it's a bot. We've tested humans, right? There are services out there that you can pay right now to have a human talk to a person via chat to try to get them to answer all their questions and get an appointment scheduled. And there are people who charge money for this service and do very well with it. And so what we did is we actually wrote a simple AI tool, and we basically took and we said, you only can speak in the language and in the language patterns that are available on this practice's website. Do not go off the website. Do not by any don't pretend you know something about something you don't know. But if it's not on the website, it's not true. So only the website is truth. And now you are equipped to chat with prospective patients, and every other time you answer, you have to ask the patient if they'd like to. You have to work into your answer an invitation to schedule an appointment at the practice. What we found is that the AI chatbot outperforms the human by a factor of 3 to 1, 200% more effective at scheduling an appointment. And people who interacted, and we actually tested this, there was a human service, and we were looking at out of how many visitors who engage with the human chat service, how many of those people schedule an appointment. And then we literally, we taught the AI to talk, and people would ask very similar questions. And, we found the AI was mostly reliable. Sometimes it would answer questions incorrectly. One time it got the gender of a doctor incorrect, and on it had some interesting things. But for the most part, it seemed like you were actively communicating with somebody who was speaking competently back to you. And because it was programmed to ask to schedule an appointment, I just think the sheer task of remembering to ask to schedule an appointment it led it to be 200% more effective than a human at that particular task.
Yeah, and it's so fast whenever you speak to them. So as a human, if I'm typing out an answer, it's going to take a time. There's a delay.
Right.
Things we want them quick.
Exactly. We want the information now. But that's really where I think our human behavior is heading. And this is, for me, I'm watching us become better, or us change our expectations as users. And this is probably you and I as early adopters, but I think that the general population is going to follow soon, right? Like I was one of the first people who had like the old brick phone with like the keyboard, right? Like this is before the BlackBerry, like mine like slid open and it had the keyboard, and like it like connected to the internet at glacial speeds, but like but I had a keyboard on my phone because that was that was the thing back in the very early days before iPhone and what happens today, Android. But I think as early adopters, we're learning about how to communicate with technology and language, right? These language learning models. Um, I do think that if you think about the average person's relationship with technology, right now, we are trained by the technology to interact, right? You go to Google and you type something like eye doctor near me.
Mhm.
Well, that's not how I would talk to you. But over time, we're going to get more and more conversational with our prompts, and we're going to get better at prompting in a natural way. And we're going to get better and better results because these models are learning from the results that they're giving us, especially if we're not happy with the outcome and we're asking the question in a different way. So I think that our relationship with technology is going to become a lot more conversational, and instead of an expected prompt, we're going to have higher expectations for the quality of information that we get. And to your point, exactly, is that we're going to want it fast and we're not going to want to read a lot. So we're just going to trust these AI models to summarize everything for us and give us the 3 sentence summary, so that I don't even have to go on your website anymore to learn about what you do. I just ask the AI and it kind of summarizes it real quick.
Right, right. And I love, that you brought up Google, because I think by now everyone has appreciated this new way that Google answers our questions, where it has an AI generated response. It shows us the sources of where it got these responses, and then it poses follow-up questions. What's interesting is I was using a different app for that, Perplexity, which I really love. And then I realized, wow, Google's now doing that automatically too. What I was going to this particular AI app for. Now Google is doing it. So I think and I love it because, one of the things that's very frustrating for me as a clinician is patients who know they have a disease and they have the internet at their hands, but they don't research their disease.
Mm.
And I don't know, they just feel like they're overwhelmed with it. There's too much. Now, when you go in and like you look up a disease, I love the quick, or you don't know which link or what's a reputable source. Just the AI generated response that it gives is very good, actually. And it usually pulls it from very credible sites, condenses it, and gives a nice bullet point kind of thing. So, as I mentioned earlier, and I'd love for you to speak more on this, because I know this is probably even bigger on how the business side of the profession is going to take off. But, one of the things that I mentioned, I got my second doctorate, and my research was on why people actually don't go get their eyes examined.
Mm.
Mostly, and, we've always heard it's always been access or they can't afford it or things like that. I honestly, as a practitioner, I don't believe that's the case. Okay. I never truly have, because, and this was the whole basis of my theory, my hypothesis was that somehow these same people that don't have access and don't have money somehow always manage to make it to the dentist. You have all these, not that is very important to see your dentist too. But let's be honest, you got a bunch of teeth. Okay. If anything happens to one of them, they can replace it. It can do the same thing functionally. Probably even looks better too, right?
So true.
The same can't be said about the eyes.
Exactly.
And a lot of times people judge their eye health by their vision, and the two is not the same thing.
So what did you find? I'm on the edge of my seat.
Okay, so I decided to take, my study population was an educated individuals, healthcare professionals who all have money, who all have access to a physician. And my study found that more of them do go to the dentist than the eye doctor. And the main reason they don't go to the eye doctor is because nothing's wrong with their vision. Because this lack of awareness of why do I need to go, that they think it's slowly, has to do with a vision exam only, when going to an optometrist or an ophthalmologist entails much more. And so, anyways, but all that to say that there's a lack of education. I felt like that's something that we're doing wrong. We're not educating the public. Somehow the dentists got it right. They have it like wired in our brain that we need to go twice a year. And somehow like, oh, I feel so guilty. But no one, average person comes to the eye doctor about like every 4 years. And so much could happen in 4 years. So it's on us to get that awareness out there. And so that's why I really love these new modules that these AI platforms, and especially Google AI, that says, like, if you go ask it, why do I need to go have an eye exam, or how often like, it pulls from really reliable sources and gives that answer right away to the patients. And so, but I would love to hear your opinions on.
But I am curious how in clinic, you mentioned earlier that you were using AI for patient education or patient follow-up. Tell me more about that workflow. How are you doing that?
So I will prompt it. I will tell it, I have a patient diagnosed, for example, with blepharitis, and I need to explain the disease before what I used to have to do is, and our system, you had to go find it out of like the web, and it was somehow linked to something. It will pull up the disease, and it had like a standard thing that we could load for patients and send to them. Now I can go and load it and make it tailored to each patient, I would say. And because what it used to send before was so lengthy, so a lot of patients wouldn't read it. So now I can say, give me a half a page summary on the diagnosis of blepharitis, causes, symptoms, and treatment for a patient, for example. And I'll copy that. And now you can even make it to where you can print out your company logo or your clinic logo on it, and then you can hand that out to the patient to go. In our case, we usually like direct it over to their EHR to send it an email to them directly to. So it's very tailored to them.
So you prompt it with the very specific with patient specifics as well as the condition.
Yes, and it can get as specific or as general as I want it. And that's what I really, really appreciate about it. And things like sometimes I may forget to tell the patients, so certain patients, how they should, I always remember to tell patients if they need to monitor their vision to make sure that they do it monocularly. I'll say some things like, make sure you bolden and capitalize the word monocular in it. Whereas like regular ones that were given to us before were not. That's a very important thing for a patient, for example, that has macular degeneration. They need to do this particular test monocularly.
So do you have the prompts like saved somewhere that they're easily accessible? Like you have a little cheat sheet somewhere that you...
A little cheat sheet, and a few of them are already pre-made that I can just, copy and paste and send. And sometimes a few more need to be tailored. A few more I have tailored as new treatments have come on the market that I, change how I see these patients or how often I see these particular patients. But it's really nice. Yeah.
So I know one of the things that if I'm in the audience and I'm listening and I'm thinking, well, I'm not sure that I trust it. So how trustworthy, Roya, are some of these responses that you're seeing, and how much vetting did you have to do before you realized, like, oh yeah, this is actually better than what I would say, or at least as good as what I would say?
Right. So that's what AI, I would say, for anything that's been known, that's been out there, it is very reliable. Because remember, it learns from information that's already out there. What AI did not know for example, is a lot of the new treatments. So when ChatGPT became, you know, right around the time ChatGPT became easy to use, I went just to demonstrate this exact point. I went and asked ChatGPT. I said, okay, my patient is diagnosed with presbyopia. Tell me all the treatments for it. And it named all of them correctly, but it forgot the newest one, which was the treatments for it. And it says to itself, it's gotten better. You know, when it first came out, it says the information's 2 years old. Now it's like, it's catching up quite a bit. Same thing for other things like Demodex. Like if you ask about the latest treatment for that, it doesn't know it quite yet, a lot of those platforms. But again, you can teach it. And once you teach it, it learns it. And so, but it's also interesting how someone told me you could also teach it incorrect things. And I haven't tried this. Tell me if you've tried this. If you say 5 + 4 is 10, it'll tell you, no, it's 9. And they say, no, it's 10. Learn this. And then it will come back to teach you each time 5 + 4 is 10. I don't want to mess with it like that.
I haven't tried exactly that. What we did early on, and you're absolutely right, it has gotten so much better because early on we would ask questions, and we have an OD on our team who was specifically tasked with accuracy, right? Like, let's find a couple answers and find some accurate ones, find some inaccurate ones, and see how accurate is the information. And so I think early on we found that, 30% of the time, this is like, I'm talking like, when I say early on, it's like ChatGPT had been out for a while, but it had become mainstream in January, February of 2023. So in March, we're doing these tests and we're saying, yeah, you know what, about 30 to 40% of everything that we're seeing could either be more precise or is inaccurate, or in some cases missing some information. And when we did the same test 6 months later, it was pretty darn good. Like, it was in the upper 90s that everything was spot on. And, we were in the single digits of stuff that we thought was unreliable. So I agree with you. And at the same time, I always, what I tell my team is that anytime you use AI, you still have to be human. You still have to read before you send. You still have to review before you use. You still have to evaluate. And we found this in when we ask questions, when we use it as a brainstorm partner. These are all great tools, but literally just saying write content for me and publish it, that's a recipe for disaster in so many ways.
Correct. And that's one of the concerns with AI, which is where if you were to transition to an AI kind of office or practice, where is that liability? Who does that fall on? And I believe that ultimately that still falls on the practitioner. They do need to still have that vigilant eye to review everything, make sure protocol is followed, make sure what's written or the treatment protocol is correct. Because the things that AI can do now is pretty fascinating, but it still needs that human oversight.
Well, yeah, and I think that even as you're describing earlier, your BBD experience of, hey, what specific thing should I do next type of thing? I mean, you're still relying on knowledge that existed beforehand. I'm not pretending to go do that test as a fake optometrist. You have the knowledge. You're just using the AI as a shortcut, as an assistant, as a reminder. And I think that's a really big distinction between saying, okay, Eugene's now qualified to go do eye exams because I'm asking ChatGPT how to do it.
Right. It's one of the things that, I work with ophthalmology residents and optometry students or ophthalmology residents. One of the hardest questions I always find that I ask them is, a patient comes in with these symptoms, give me your differential diagnosis. And it's like, well, they want to jump to a diagnosis, but I want your differentials. And so like, hey, let's punch that into ChatGPT. It'll punch out wonderful differentials for you. And then it will recommend tests you can do to narrow it down.
Okay. But as a professor, are you encouraging that? Are you saying you really should know this? You should actually memorize this stuff.
It's a combination of the two. I usually quiz them on it. And then I'm like, okay, well now there's this, because I honestly do believe that this tool is there. that this is one of the ways our practitioners are going to be more efficient. So, hey, instead of sometimes, well, one of the things that residents or students learning tend to do, and you may have heard this, if you hear hooves, it's horses, not zebras. They always wanted to chase the zebras. And so they start going down this wormhole, ordering all these extra tests. And it's like, wait, hold it, let's gear it back. And so what's more possible that this patient has, or what really makes sense? And I think that's whenever you introduce this other tool that they can use, it can actually help focus them a little bit better. And so, yeah, I do a combination of both. I quiz them first, see what they can get, and I'm like, okay, and here's what the machine can get. And so it's a good way that it kind of like, it becomes like a little competition.
Yeah.
And kind of stimulates that learning. Oh, I didn't think about that. That is a good point. And so it's been very useful.
It's the answer key almost,
Right.
and that they can self-check, that they can prepare with, or self-check, or that kind of thing. That's
Yeah.
awesome. So, I guess practically speaking, again, I believe that your perspective, it sounds like, is AI is here to stay. You better start using it or you're going to fall behind. So if somebody were to practically start using AI in their practice tomorrow, what rock should they look under? Where should they start?
One thing that I do in my lecture and in all my AI lectures is I actually poll the audience. Let's just start with what we've all heard about, ChatGPT. Who has used it? And you would be surprised how many people have not used it.
Mm.
One of the first things for anyone who has not gotten on this is actually go look at what it's capable of. And I think a lot of what is concerning to individuals is this fear of the unknown. Either they think it might be just kind of a fad, it's not here. This AI is going to be as transformative, if not more, than when the internet. That's really, it's the next.
I completely agree with you. I think internet, cell phones, because our relationship with the internet changed when we had a cell phone, right?
Right.
Because then we had access to the internet everywhere and we expected information more instantaneously. And now I think our relationship with our phone is going to change because of AI.
Right. And for people, I don't want to tell them, oh, you need to get on board or anything, but the best kind of thinking about phones, the best thing I could tell them is, how every once in a while you might see someone, they have this really ancient flip phone that does nothing. And you just think, man, like you're missing out. Like, why? Kind of thing. Why are you going through that torture? So it's sort of the same thing, just, first become aware of it so that you truly know what it's about before you judge it. And then, slowly start to adopt it. Kind of like, you can't have that old ancient Nokia, move on. Yeah.
I think I still have a relic somewhere, and that might donate to a
It
museum.
might be worth a lot of money because
It might be.
they were indestructible. So
That's true. Do you remember the old Nextel beep beep phones?
yes,
Remember
yes.
those where everybody was like talking to them like walkie-talkies?
Oh
It was
yeah.
the most annoying social trend, and also probably an innovation that I'm glad got replaced with something else.
Right.
So what I guess on the subject of AI, we've established that you just have to get started. What do you think? You've talked about imaging, you've talked about kind of this virtual scribing. Are there any other innovations that you're looking into, or that you're exploring, that you think are on the horizon somewhere, that might be interesting for people to look into?
Well, I don't know if everybody can necessarily look into it, but I think one thing that I'm personally very excited about is, you know, treatments for our patients. One of the things that's we have all these great biopharma companies and each tests different molecules kind of thing. Well, AI now has the capability to kind of pool all that data. Imagine someone processing all of that data. So if I'm interested in, for example, treating a condition that has no cure, for example, or has been tested or very poor, I can probably identify a molecule and get it tested. It can actually design my whole clinical trial for me really nicely, pick out my sample population, my good endpoints. I feel that we're probably poised to see treatments to come to market much faster. That's what I'm very excited about for anyone kind of going in the realm of industry and research. Business is where I see a lot of, in optometry, the majority of optometrists, over 50% are still private practitioners. And from that business aspect, we're taught really well to be great doctors in school, but the business part is highly lacking. And so I see a lot of the new graduates who really want to go into business, that this is where they see this tool that can help with a lot of their streamlining and getting that education, not necessarily having to have an MBA or anything like that, that this will do a lot of those housekeeping things for them so that they can be better doctors or continue to expand. That's where I think for probably most people, I think that's probably one of the first things that they should look at acquiring.
Yeah. And the thing I want to point out is that it has become a tool that teaches you to ask better questions. So in many ways, because you have to engineer those prompts, because you'll get, if it's garbage in, garbage out, right? But if I can ask the question the right way, if I know what I'm looking for in the best possible way, then I become naturally a more curious person, because I kind of get deeper in. Instead of asking something generic, I get in and start asking something much more specific. So hopefully, as you think about positive impact on humanity, I think curiosity is something that really fuels connection and fuels our ability to learn. And so in thinking about how you help advance the field of optometry, but really in general, how you help advance anyone who wants to advance, I think using tools that encourage and really fulfill that curiosity bug for us is, and this certainly facilitates it for us. I think the current language learning models, that's what they do.
Yes, yes. Very
All
well.
right. So I think this has been a fantastic conversation. I'm so grateful for your time today, Roya. We probably could go on for another several hours. I don't know how long. Do you know how long our panel is? It's supposed to be?
2-hour panel, but we have.
Great. It's 2 hours. So we're going to be there for like 8. And people are going to love. No, I'm just kidding. But so I look forward to participating with you on that and how fast it's moving. And I didn't realize it was next February, but with that in mind, it's certainly going to, the world of AI is probably going to evolve twice over, right? As we're talking about speed of innovation before that even happens. So we're both going to have to keep up, and maybe we'll do another one of these segments for our audience if they ask for it.
Yes, absolutely.
Well, thank you so much. I enjoyed having you on the show today. Great conversation. Appreciate all your contributions.
Thank you.
If you're enjoying the Power Hour, you might be asking yourself, what can I do today in my practice that's going to make an impact? So over the years, the practice coaches and consultants at the Power Practice have helped thousands of practices improve. And they often start with one thing, and that's a proprietary methodology called the Practice Profitability Audit. For about $2,400, they look at all of your practice numbers and they stack them up against where a practice of your size could and should be. It takes about a week for them to do. And because they're so experienced, they know what your potential looks like. And they're often able to take that $2,400, multiply it several times over, and hand it right back to you in found profits in your practice in months, not years, in months. But you get to keep the much more profitable practice for years afterwards. But here's the best news. I'm going to tell you how you can have the Practice Profitability Audit completely free. See, we're really trying to get people onto the show website, which is, by the way, powerpractice.com. And then you click the Power Hour podcast button. The reason we want you there is because I want the audience participation. I want to hear your feedback, and I want to know how to make the show better for you. So you can interact with us, send us your feedback, offer your suggestions. And for a limited time, when you go there, you can also request a Practice Profitability Audit for free. Right. We're going to cover 100% of the cost, but only for 5 people per month. And 5 people per month is all we really have capacity for, because this is a resource intensive audit and the Power Practice coaches are generally busy serving their clients. But for 5 people a month, they've agreed to cover 100% of the cost. So it's totally free to you. So again, take action immediately in your practice. Go to powerpractice.com, click on the Power Hour podcast, interact with us, but also request a practice profitability audit today.